Hello friends, welcome back in my channel, that is Pharma-info with Shivashish. Today the topic of discussion is found to be phenothiazines as antipsychotic. Okay, we know that phenothiazine is a very popular term, okay, in antipsychotic drug regimen and all. And long back in the year of 1880s or 1882, I think, yes, the ring system came into the existence, right? It is the ring system that was deduced long back in the year of late 19th century, right? That is in 1882 or 3, right? And later on, in the year of 1950s, okay, they started making the derivatives of phenothiazines, right? And just projecting it into the manic patient and all. So later on, it was observed that it is the phenothiazine derivatives which was found to be beneficial in the treatment of psychotic disorders. We know that psychotic disorders, there are very different types of psychosis are there, or psychotic disorders are there. There are several types like schizophrenia, then mania, and all these things are there, right? Okay. Now let us just, as I have mentioned here, phenothiazines as antipsychotic. So in the coming discussion, the one that we are going to discuss is, first and foremost, we came to know that phenothiazine is a drug, or phenothiazines are especially applied to in the treatment of psychosis, right? So that means phenothiazine derivatives. What all the phenothiazine derivatives are there? That primarily they are used in the treatment of psychosis. That is why they can also be categorized as antipsychotic drugs, right? Okay. Now let us just move to the mechanism, because before getting into that chemical aspect or the SAR study of phenothiazines, let us just know that what is the mechanism all about, how they are exerting their action, how a psychotic patient will feel some kind of benefit out of that, with that particular drug, right? Okay. Now coming to this mechanism, what they are telling, what they observe, that it is basically phenothiazine derivatives while being treated as an antipsychotic. So basically they are acting on dopaminergic 2 receptor, right? So it is the dopaminergic 2 receptor, okay, that is being targeted, and the purpose is not to promote its action. The purpose is to inhibit the action. Inhibit the dopaminergic receptor, or antagonize the dopaminergic receptor. So that means we can say phenothiazine derivatives, to be considered as an antipsychotic, they are preferentially acting on dopaminergic receptor as an antagonist, okay, while developing the antagonistic effect at that particular site. They're just elevating the symptoms which are found to be present in case of psychotic patients, right? Okay, they are just improving the symptoms, right? Now, so we know that basically in psychosis we have two different classes, like your typical psychosis, atypical psychosis, right? And we know that it is the typical psychosis, they can be treated with medications and all, and that is not found to be that much detrimental, right? But on the contrary, if we just try to figure out the atypical psychosis, that is basically why that is found to be fatal, because the symptoms is found to be social withdrawal and suicide, right? So that means, but the suicidal tendency is found to be very less or negligible in case of typical psychosis. And in that case, phenothiazine is found to be the drug. So what all the phenothiazines that has already been developed, okay, till now, they are basically or primarily working on what? Typical psychosis. So that is why they can also be called as typical antipsychotic. Now, so that means it is clear that how they are exerting their action. Okay, why I have brought the mechanism of action before entering into the chemistry? Because it is the dopamine from which they got the clue that what should be the real feature of the compound which is likely to be incorporated in the system which is suffering from psychosis, right? So why dopamine? That means the purpose is to antagonize dopaminergic receptor. For that receptor which is found to be the primary ligand is found to be dopamine. That means the one which is likely to be considered as a dopaminergic antagonist should have a similarity, should have a structural resemblance with that of dopamine. That means what they observe, that anything or any chemical skeleton, okay, when it mimics the structural features of dopamine, that is something like we all know that basic structure of dopamine is found to be something like this. We have a catechol nucleus, because it is found to be the precursor molecule for the production of noradrenaline, right? So, but we don't have any beta hydroxy here, followed by CH2 and followed by NH2. So this is a basic form of what? Dopamine. That means any moiety, if it orient or if it mimic the structural feature of what? Dopamine, can behave as an antagonist. And of course, we have to incorporate some other features as well. Otherwise, the same thing can act as a dopaminergic agonist. But the purpose is to antagonize the dopaminergic receptor, right? Okay. If that is the case, that means this has to be kept in your mind. Okay. In the further discussion, that means all the time you must be in a process that okay, what are the structures that we are going to make, or what are the shape that we are going to give to that phenothiazine. Keep it in your mind that it should have a resemblance with dopaminergic receptor, or rather dopamine. That means we should have a dopamine like arrangement inside the chemical skeleton, right? Okay, so what are the phenothiazine that has already been developed, each and every one, they're having a structure, or they just orient themselves within the system in such a way so that they can acquire the dopamine like structure, right? Now, so moving ahead from this point to the other point, that is, let us just bring the SAR study, right? So SAR study, and from that SAR study, at least we can get to know that what are the modifications, okay, that are permissible, what are the modifications that are found to be restricted, right? So let us just figure out phenothiazine, okay? So this is the basic structure of phenothiazine, right? Okay. This is basic structure of phenothiazine. Okay. Now if we just start numbering this one, so this is 1, this is 2, 3, 4, 5, 6, 7, 8, 9 and 10. 10th nitrogen, right? Now here we have, so this is the moiety I was talking about. This is the moiety which was invented long back in the year of 1880s, right? Or 1880s. And later on, they just modified, they just derivatized phenothiazine. That means it is the N10 with which, or to that, one hydrocarbon chain has been attached and followed by a a tertiary amine, and then they just got what are the structure, or the structure which they got is nothing but phenothiazine, or rather chlorpromazine, right? I'll just tell, no problem at all. So CH2, CH, I'll just put here R, right? Okay, CH2 and then N followed by R prime and R double prime. And here at the second position we'll just put X, right? Okay. So this is found to be the basic skeleton of what? Basic skeleton of phenothiazine. Now let us move ahead. Let us just discuss one by one. First and foremost, let us do one thing for our, simply the convenience of presentation. Let us do one thing. Let us just split the entire skeleton into three different, sections, right? What are those? The phenothiazine portions, right? The alkyl side chain portion, and finally the tertiary amine portion. Or we can say, if we just consider this as alpha, this one is beta, and obviously this one is gamma. Okay? With that, to that gamma carbon, one nitrogen is attached, terminal nitrogen is attached, and that should be preferentially a tertiary one. That we'll see later on, right? Okay, now let us see one by one. So, what are the things that we are having? So, we have just split it, the entire skeleton, into three essential fragments. And now let us deal with them one by one. One after another, we'll just complete it, right? Okay. So now, जैसे कि अभी आपको ये लग रहा है कि ये phenothiazine है. Phenothiazine है मतलब the total thing, that means it's a kind of, all in a row arrangement. It's a tricyclic system. Two benzene, okay, and which are sandwiching what? Of a thiazine nucleus. So this is found to be thiazine nucleus, right? So as a whole, this is phenothiazine. Okay. Now phenothiazine is found to be the prerequisite. That means this skeleton or the template should be there, or should be, it's found to be the essential requirement, right? Any alteration to the template leads to, there is no amelioration, right? There is, depletion in the activity level and all. What I mean to say is, you are not supposed to alter this. Something like benzene can be altered with thiophenol, it's not like that. Or sulfur can be further derivatized, it's not like that. Okay. Let me just make it more clear. What I mean to say with this alteration. Suppose ki all on a sudden you thought that, okay, better just convert this sulfur into this sulfur. That means the S5 sulfur, okay, into either sulfones like double bond O, okay, or sulfene, rather sulfenes, or sulfoxide, anything sulfoxide, or sometimes sulfones. So this is sulfonyl. If we just remove another oxygen, this will become sulfenyl, right? Okay. Neither sulfones nor sulfenyls are found to be acceptable. The moment you are just converting the sulfur, that means the ring sulfur, to sulfenyl or sulfone, which ultimately leads to what? Loss of activity. That means you are not supposed to alter the state of the ring sulfur, right? Okay. Now, this is the thing which I mean to say. That means alteration of the ring component leads to what? Leads to depletion in the activity level. Activity level means antipsychotic level. Now, so that means let the sulfur be as such. Let the sulfur be as such. Okay, we're not supposed to alter the state of the sulfur. Okay. Now let us see that to that ring, what are the areas which are likely to be substituted? That means where substitutions are found to be favorable. What to observe that it is the second carbon as well as the third carbon. They can readily accept what? Substituent, right? Okay. It is the second carbon as well as the third carbon. They can readily accept the substituent, right? But the thing is that if we just consider, if we just think that, okay, are they similar in accepting the substituent? Whether the substituent while being placed in either of the position will give us the same kind of activity? It's not like that. So what they observe that a substituent, as I have just put here X, that means there should be some significance to that X. What should be the pattern of the X? What they found that insertion of an electronegative atom. What are the electronegative atoms? Like chlorine, like trifluoro, like methyl thio. So these are the kind of electronegative atom while being placed at the positions 2 of this phenothiazine ring system, which is found to be one of the essential requirement, right? So one of the essential requirement for the proper D2 affinity to grow, it is the electronegative atom, and that should be placed at the position 2. So that means this is found to be the optimum one. Okay, so at insertion of an electronegative atom at position 2 leads to the optimum affinity. When there is an optimum affinity, what we can expect as a result of that particular affinity with the receptor, what we can expect? A significant level of what? Significant level of biological response that we are after. We are after healing, we are after curing the psychosis, right? We are after addressing the symptoms of psychosis, right? Now, coming to this particular area, third position, as I mentioned that, yes, in both the areas like second and third, both can accept what? Substituents. Now, I just want to focus on the point that which is that area which is found to be more attractive or more prone towards accepting the things, or substitution at this particular position, whether it is found to be better than this or not, right? Okay, that means intensity of the activity. Yes, of course, it is the second and third both can accept substituent, but the intensity of the activity profile differs. What to observe that the similar substituent, that means electronegative atoms, right? Electronegative atoms, while being shifted from here to here, give us a good activity, good antipsychotic effect, but that is not that much better as that of the substituent while being placed at the second position. That means it is the second position, substituent at second position, that is found to be more predominant, or that is found to be more effective or more efficacious than that of the substituent while being placed at position 3. It's not deleterious. It can give you a good compound, but that is not better than that of this. Am I followed? Chalo. Now, so we are done with these two. Coming to these two areas, like position 1 and position 4. Okay. What they observe that either of the position should not be substituted with what? Any kind of substituent, irrespective of their nature. Whether they are electronegative or they are, hydrophobically bulkier, it's not like that. That means either first or 4 should not be substituted. That means you are not supposed to substitute position 1 and 4. I'll give you the explanation why it is not so. Right. So position 1, what will happen? Later on we'll discuss why there should not be any substituent at position 1. Now coming to this fourth one, what they observe that substituent at position 4 leads to what? Leads to the development of deleterious effect. That means अगर आप ये जो 4 नंबर पोजीशन है, यहाँ पे आप कुछ सब्स्टिट्यूएंट दे देते हो, इसका मतलब क्या है? जो भी कुछ कंपाउंड बनेगा, भले उसका एफिनिटी हो, लेकिन that will not give you efficacious at the same time a compound with less side effect. Side effects are found to be peeping up, right? Side effects are found to be more. That means it can give you a compound with antipsychotic effect plus in addition to this some fatal effect. That means it is not found to be acceptable. That means substituent at position 4 often leads to the production of an antipsychotic with lots of untoward or side effects. So that means it is not found to be acceptable. So ये 4 number, we are done with this 4 numbers, okay? So substituent at this 4 position. Now, coming to this particular ring system, what they thought or what they said that You are not supposed to any of the position, that means 6, 7, 8, 9. You are not substitute any of the positions in this particular ring system. That means this should be for the proper antipsychotic activity to grow. These 4 positions should not be substituted with any sorts of substitution, right? Okay. Now let us see that coming to this area, that means the side chain. One side chain comprised of an amine at the same time alkyl should be inserted at position 10. That means it is the 10th nitrogen that should hold a chain, side chain, right? And the side chain is essentially comprised of or composed of a hydrocarbon followed by a nitrogen or a terminal amine, right? Now, I have not done with the substituent. I have not done with this explanation. That means why there should not be any substituent at position 1. Let me just complete this one, then only you can get to know that why it should come later. Why I have not completed before, right? Okay. Now, as I said at the initial stage that all the phenothiazines, okay, they are orienting them in such a way, or they are fashioned in such a way that they should develop a dopamine-like arrangement, and then only they will be accepted as a pseudo-dopamine at that particular area, that means inside the dopaminergic 2 receptor for the purpose of antagonism to develop, right? Okay. Now, as I said that, say usually, what about this? Now coming to this alkyl chain, more or less partially we are done with the first one, the first splitting product, that is phenothiazine. Now coming to this alkyl chain, what to observe that neither lengthening nor shortening is found to be permissible. So that means the hydrocarbon chain should comprise of 3 carbon, okay? That means neither lengthening, that means you are not supposed to make it 4, neither 4 nor shortening, that means or 2. That means both the things which leads to loss of activity, right? So that means the chain should be fixed. Now, as I have mentioned that this is found to be the alpha, this one is beta, and this one is, just see, this is beta and this is gamma carbon, right? Now, coming to the substituent at position beta, right? I have just put one R here. That means probably some substituent can be inserted. Probably we can go for further branching, right? So what to observe with this hydrocarbon chain, the central carbon, that means the beta carbon, can be substituted, but which leads to the development of antipsychotic with variable activity. Activity बढ़ भी सकता है, घट भी सकता है. Chances are there. Okay, that means it is found to be dubious in character. What are the substituent that you are going to introduce at this particular area? That means if you are going to branch the centrally placed carbon, which often leads to with a smaller, sometimes an alkyl group, sometimes a hydro or a polar entity like hydroxyl, right? But in both the cases, often results in the production of what? A compound with variable activity. So that means branching often leads to variable activity and all. Now, coming to this area, so we are done with this, the third section, that is the second section, that is the hydrocarbon chain. Now coming to this, at the end, that means to that gamma carbon, one nitrogen has to be placed. That means a terminally placed nitrogen should be there. Now let us see that what should be the nature of this terminally placed nitrogen. The terminally placed nitrogen should be tertiary in nature. The terminally placed nitrogen should be tertiary in nature for the proper action to be elicited, right? Okay, tertiary in nature. And now coming to the, as it is tertiary, that means 2 substituents are there. Okay, so what they say basically, they are asking us to make both the R or substitute both the R with smaller alkyl, preferentially methyl. If it is found to be ethyl, then there is the chance that activity may fall down, right? So that means R prime and R double prime both should be made up of methyl, or both should be substituted with or inserted with a methyl, not ethyl. That means here bulkiness is not at all found to be preferable. Okay. Now sometimes it has also been found that the tertiary amine should not be free. That means there may be some other fashion by which you can incorporate the nitrogen, right? Sometimes it has been found that the nitrogen can be incorporated in a cyclic system like a piperazine. What are the other option? Yes, we have other option, that is sometimes in piperidine as well. Okay, these are the other options, right? Other options by which we can keep the nitrogen in a ring system. That means nitrogen we should have, that too in a tertiary form. Okay, now in this case it will be free hai, lekin the thing is that this can be incorporated in a cyclic system. Then also we can retain the activity. Sometimes the activity is found to be better, even better. If we just try to prioritize them, this will come first. It is the piperazine, okay? That will just snatch away the position and all. So it is the first position. We have to place the piperazine in the first position, followed by what? The aliphatic, and third one is found to be piperidine. So the order of this, nitrogen is found to be, first one, that is piperazine, is found to be the highly acceptable piperazine, then followed by piperidine. Okay, piperidine. Not piperidine. So piperazine, then your aliphatic amine, and then piperidine. So this is found to be the order of reactivity. That means this is found to be highly interactive. This is found to be moderately interactive. This is found to be least interactive. So all are found to be an option. So we have basically three choices. That means the nitrogen, okay, we have to place one nitrogen. Sometimes it is open, sometimes it is closed. But the closed one is found to be, that means piperazine is found to be highly acceptable. As I have just kept it first, so that means this is found to be highly acceptable, followed by aliphatic, followed by piperidine, right? We'll put some example also, no problem at all. First, let us do with this. Let us done with this. After that, we'll see. Now let us see that why I have just skipped that one, the explanation of this of the substituent at position 1. Why it is not permissible? Let us just draw that one only, that thing only, right? A small portion of it. We'll just okay, small portion. We have the entire thing here, right? Now here basically we have a carbon, right? Assume that. So this is found to be the first carbon, and this is found to be the second carbon. We are done with this explanation, right? Second carbon. So this is first carbon, right? Okay. And to this nitrogen, we have an aliphatic chain made up of 3 carbon followed by a nitrogen, right? And that should be a tertiary one, right? That should be a tertiary one. So what I told, that the tertiary amine, right? So that tertiary amine. Now, the thing is that it is the position 1. As I said, that position 1 should not be substituted with any kind of substituent. Why it is so, right? Okay, I forgot to tell one thing. I told the nature of the nitrogen, the terminally placed nitrogen, right? Okay, it can be a it can be incorporated in a cyclic system. It can be a part of a aliphatic system. But the thing is that, can it be a quaternary one? No. The state of the nitrogen should not be a quaternary. Why? Because it has to cross the blood-brain barrier. The moment this will get quaternized, okay, prior entering into the system, so definitely it will be restricted. So that means the transmission, or we can say the traveling of this quaternary ammoniamine to its destined place, that is inside the dopaminergic receptor, is found to be halted. Okay, so that means the moment you will just convert this one in a quaternary ammonium 1, what will happen? As it has to cross the blood-brain barrier, so as a result of it, it cannot cross. Why? Because it is very hard for an ionized species to cross the blood-brain barrier. So that is why you are not supposed to keep the terminal nitrogen in the form of a quaternary ammonium species, right? So we are done with this explanation. Chalo. Now coming to this explanation, why is it so that you are not supposed to put any kind of substituent here? Okay, as I said that bhale kuch bhi kar lo, the dopamine-like arrangement is found to be one of the prerequisite. Chalo. Now assume that from where, out of this entire skeleton, are we able to figure out the areas which is having a resemblance with dopamine? Suppose ki in dopamine we have 2 hydroxyl groups. So dopamine possesses 1 catechol nucleus. Suppose ki this is the phenyl, and this 2 sulfur and nitrogen both are found to be electronegative. So with that they can be related with 2 hydroxyl, right? Of what? Dopamine. Now dopamine do possess what? The side chain, which is made up of 2 carbon followed by a nitrogen, okay? Followed by a nitrogen. So now here we have, so that means here, in order to in order to develop the dopamine-like arrangement, the bending of side chain is found to be one of the important phenomena to be occurred. to be taken place, the bending of side chain, until and unless this particular side chain is not bending towards the ring system, no longer it will develop a skeleton which is as similar as that of dopamine. Am I followed? So that means this is the hydrocarbon chain followed by the nitrogen, as we have seen that hydrocarbon chain followed by nitrogen. That means the nitrogen should be pulled to this direction. And how this can be pulled? As we have placed one electronegative atom here, what will happen as a result of it? What will happen? It is the, and let me tell you one thing, it is a neutral form that is found to be acceptable for ingestion and all, right? Once things will get ingested later on in biophase, this particular tertiary amine will get quaternized, right? The moment it will get quaternized, what will happen? A quaternary ammonium charge is being highly accepted or highly pulled by an electronegative atom. So the moment it got transformed or it gets transformed into a quaternary ammonium, suddenly what happened? The electronegative atom being placed or being considered as one of its immediate neighbor, it is being pulled by this, and that is why the bending starts. Bending begins the moment the tertiary will become quaternary, the moment electronegative atom as a proximal neighbor recognizes a positively charged quaternary ammonium species. Suddenly this will just try to attract what? The quaternary ammonium ion. But don't get confused. The quaternary ammonium ion we are not introducing in a system. The quaternization is being made inside your system when it comes in contact with the biophase. It's not that we are introducing the phenothiazine in the form of a quaternary ammonium species, right? So quaternization has to be taking place, but that too inside your system. Okay, that means after crossing the blood-brain barrier in the form of a neutral species, after reaching the target only it will get quaternized, right? It can also happen. So it is a kind of postulation. What they observe that it is the neutral form of the phenothiazine while being entering into a system, while being exposed to the biophase, it will get quaternized, and suddenly it is being sensed by the electronegative atom and the pulling operation begins. That means it has started to bend towards this direction. The moment it just try to bring the entire thing to this direction, what will happen? Suddenly it acquires what? Dopamine like arrangement. Now अब the question here आता है, the moment you were putting one substituent here, suppose कि one substituent you have put here as y, what this y will do? It will just form a barrier in between these two, electronegative atom and the quaternary ammonium ion, and that is why you are not supposed to put anything here. While substituting the position 1 with a substituent, you are just putting a stumbling block between these two. Until and unless the stumbling block will not be, that means until and unless this can sense the quaternary ammonium ion, this cannot pull it to this direction, right? And if by any means we can put a stumbling block here, what will happen? It cannot recognize the quaternary ammonium ion, right? भले ही आपका वहाँ पे quaternization हुआ है, लेकिन as we have put a barrier here, it cannot sense, the electronegative atom cannot sense the quaternary ammonium ion. So no pulling, and if there is no pulling, no dopamine-like arrangement. If there is no dopamine-like arrangement, receptor fails to recognize the pseudo ligand. And finally, there is no dopaminergic blockade, and if there is no dopaminergic blockade, that means antipsychotic effect will not be there. Followed? So that is why you are not supposed to put any kind of substituent at position 1, neither here nor here. Got my point? So with that, we are done with what? We are done with the SAR of phenothiazines. Okay, we are done with the SAR of phenothiazines. Now let us see the applications, right? Applications. Whether what are the compounds that are there in the market, they are complying the SAR or not, right? Okay, is there any similarity with so what are the things that we studied in SAR? Are they totally matched with this particular compound or not, right? So I have just written here three different compounds, okay? And due to some space constraint, please bear with me. Okay, let us see that how this can be further, at least we need a bigger board, because as we are dealing with the chemistry and all, okay? Okay, anyway, so now this is your what? This is your chlorpromazine. Okay, we all know about chlorpromazine. We have a chlorine here, right? We have a side chain that is made up of 3 carbon followed by an aliphatic nitrogen, and here we have placed 2 methyl. That means it totally complies. It totally complies with the SAR requirement and all. So what are the informations we gathered from SAR? That means all are found to be compliant here, right? Now coming to the other one, that is where there is no hydrocarbon chain. But what happened? Pyridyl alkyl. Okay, so here this 2 carbon along with this carbon followed by nitrogen, and this nitrogen is found to be even though it is a part of a cyclic system, but there we mentioned the nitrogen should not be always free. The first priority should be given to the piperazine. That is nothing but a cyclic system. So that means it is piperidine. I'll come to the piperazine of course. Obviously I'll come to it. Now we have a drug called thioridazine. Thioridazine is an example in which we'll find what? We'll find the piperidine along with the alkyl chain, right? Okay, this should be the feature of thioridazine. Of course, in thioridazine you won't find the chloro at position 2. Instead, methyl thio should be placed at position 2. Now coming to this, the final one, that is your trifluparazine. Okay, in case of trifluparazine, this is found to be the feature. That means one alkyl, that means 3 alkyl are there. That means 1, 2, 3, 3 carbon. That means the alkyl chain composed of 3 carbon followed by a nitrogen, and that nitrogen is also a part of a cyclic system. That is a piperazine. Right? So here, these are the 3 applications which I have just shown you, so that at least we can relate the SAR informations with the structures which are existing in the market, and they are found to be reigning the market like anything till date. Okay. So with that, we are done with what? The phenothiazines, how they are exerting their actions, the clinical indications, okay, of phenothiazines, and the SAR study of phenothiazines. Now in a nutshell, let me just explain what are the things that we have studied here. Basically, we have studied what? The indications, and the primary indication is found to be psychosis, okay, is the indication. Then we move to the mechanism of action. So what we observed in mechanism of action, we have found that it is the D2 receptor, okay, that need to be blocked. That means we need to make what? D2 antagonist, right? For that we have chosen a particular compound that is called phenothiazine derivatives, right? Okay, so phenothiazine derivative, we have seen the basic requirement, one template, that is phenothiazine ring itself. We have seen the positions which are likely to be substituted inside the phenothiazine, that is your position 2 substituted with an electronegative atom, right? Like your chloro, trifluoromethyl, then methyl thio. These are the possible choices that we are having with us, right? And then at position 10, that means I'm talking about the ring nitrogen of phenothiazine, that should be inserted with an alkyl chain, right? And that alkyl chain should be composed of 3 carbon. Neither lengthening nor shortening is found to be permissible here, right? And followed by, once we are done with this 3 carbon alkyl chain, that should have a nitrogen at its terminal, the other terminal, right? So nitrogen, and the nitrogen, nature of the nitrogen, it should be a tertiary nitrogen. It can be an aliphatic one, it can be a part of a heterocycle system. And we have seen, if we just prioritize them, you can find that it is the piperazine. That means the nitrogen, while being a part of a ring system, okay, gives us the maximum benefit. That means piperazine followed by aliphatic nitrogen followed by piperidine, okay, piperidine. And there we have found that if we just keep it as such, like your tertiary kind of substituent that can be inserted at that particular nitrogen, they are found to be smaller alkyl, that is preferentially methyl, no ethyl, only methyl, right? Okay, and we left out one more point, that is the beta carbon, the side chain beta carbon, right? So the chain or the hydrocarbon chain which is linked to this ring nitrogen, the beta carbon, the central carbon can be substituted with a substituent, but which eventually leads to the production of an agent which can give us a variable effect. So with that, I think that we are done with what? The SAR of phenothiazines. Now I strongly recommend you, please do not stick to this particular lecture, okay? Instead you just search n number of articles and all, and of course in YouTube we have we have several lectures, right? All are found to be very effective, very beneficial. Please put your focus onto that particular on those videos and all, okay, that are also found to be beneficial. Those are also found to be beneficial. Now at last, as usual, if you just liked my video, please hit the like button, and please do subscribe my channel so that you can update along with me. So what are the things that I am uploading, you can readily get to know that what is there in my channel. So thank you very much for your patience hearing. Thank you.